blood clots, or DVT-PE, which is essentially a pulmonary embolus, and they're offering blood thinners as a solution. And blood thinners are critically important to save lives once you've had a pulmonary embolus. Equally important is the fact that we're beginning to determine that the increasing numbers of pulmonary emboli that we're experiencing might be due to an infection in the gut. Pulmonary embolus is a life-threatening blood clot that dislodges from the veins in the legs and travels to the lungs, blocking the ability to breathe and take in oxygen. I've had 2 patients have PE out of the blue in the past 3 to 4 years. Otherwise, very healthy women, taking their supplements, taking care of themselves, exercising. Now on blood thinners, debating if they can come off or not. I investigated this link because I had diagnosed one of them with SIBO shortly after she was diagnosed with her PE, and the other I had wanted to do testing for the past couple of years, but she hadn't yet decided to move forward. I found a Cleveland Clinic study recently that was conducted showing a link between SIBO and pulmonary embolus. In fact, the Cleveland Clinic found that SIBO increases the risk of a pulmonary embolus by 100%. This is more than cancer, hormones, or any other known risk factor for pulmonary embolus. This is a big deal. SIBO is also linked to cardiac disease, according to a study released in 2018 by the Cleveland Clinic. Patients diagnosed with SIBO have double the risk of heart disease when compared to patients who do not have SIBO. Diabetes risk is also doubled when you have SIBO as compared to when you don't. And so is chronic kidney disease. You have double the risk of chronic kidney disease in the presence of small intestine bacterial overgrowth. So the risk of diabetes, kidney disease, heart disease, and pulmonary embolus is doubled in the presence of SIBO. All of these conditions are life-threatening. It's easy to see once we appreciate the function of the small intestine, how its dysfunction could lead to other more serious diseases like diabetes, heart disease, kidney disease, and lung pulmonary embolus. If we can't absorb critical antioxidants, fats, proteins, and more, the functions that result from these critical nutrients can't take place. Over time, fewer and fewer nutrients are available to supply proper body function, and it deteriorates more and more. Studies have not yet linked an increased risk of cancer to SIBO, but it makes sense that this connection would exist for the same reason. Chinese medical theory can lead us to this conclusion based on the idea that SIBO is already shown to impede circulation and cause toxicity. TCM causes of cancer include gut deficiencies, which they call spleen sheet deficiency. It also includes what they call toxic heat, which would be the equivalent to toxins and acidity produced by the bacteria in the small intestine. Phlegm nodulation is also a cause of cancer according to TCM medical theory, which would be the equivalent of a type of inflammation. So the link between cancer and SIBO can be seen through the eyes of TCM if we follow the dots. So now I'd like to discuss symptoms that should cause a high suspicion of SIBO and how it can be diagnosed and treated. The symptoms of SIBO may vary from none to nausea, bloating, constipation, loose stools, and heartburn. Symptoms are not a requirement to have SIBO. I've had several patients with SIBO deny any direct gut symptoms. Excuse me. Yet they had multiple nutrient deficits not corrected by proper nutrition and proper supplementation. These patients had more symptoms like fatigue or anxiety or mild depression. They had no direct gastrointestinal symptoms. And when we repeated their nutrition testing, we confirmed the presence of continued nutrient deficits, which pointed towards malabsorption. So we did breath testing and confirmed the presence of SIBO. We'll talk about breath testing as the gold standard of SIBO in a bit. But TCM can tell us right away that SIBO may be present when we evaluate with the 4 examinations. There could be symptoms of fatigue, loose stool, poor appetite. That can lead to the diagnosis of spleen Qi deficiency. There may be a thick white or yellow tongue coating, indicating inflammation, as well as possible redness of the tongue, loosely indicating toxicity or acidity. The diagnosis is much more involved than this, but these are some things that might be found on evaluation, which would trigger further testing. A high index of suspicion is needed for proper identification of this very, very dangerous risk factor for life-threatening diseases. I've developed a healthy paranoia in recent years around this infection as the data has come pouring out about just how dangerous it is. Why does SIBO create symptoms? Nausea and bloating and heartburn can result from the toxins made by the bacteria that are infecting the small intestine. They're released into the small intestine can lead to feeling full, having a loss of appetite, or even an increased appetite. The bloating is caused by gases emitted by the bacteria. Most frequently, these gases are hydrogen and methane gases. So despite our technology and spending twice as much as any other developed nation on the planet, heart attacks remain the #1 cause of death. So now we have evidence that 74% of Americans have gut symptoms, and 70% of them are likely to have SIBO, including 70% of children with gut symptoms. This leads to the urgency that this condition should be hunted down and treated aggressively as a means of preventing heart attacks and other significant diseases. So why is it so hard to do? One idea is that our conventional medical model is deductive. We cut things up into smaller parts. So cardiologists deal only with the heart and don't look at the links between the gut and the heart. Gastroenterologists look at the gut only and don't link gut diseases to other body symptoms. We all work in a box and don't collaborate enough to utilize the data that's pouring out in the medical field. The field of integrative medicine is different. It is holistic by its nature, not deductive. So the link between different body systems is very well understood and appreciated. This is why seeing an integrative medical doctor can make the difference between life and death. And this is why in 2014, the American Board of Physician Specialties formally recognized integrative medicine as a medical specialty. SIBO is not so much hard to diagnose, but it's not visualized directly with standard medical testing. We have to indirectly find the culprits by measuring gases that they emit in response to eating sugar. So we talked about bloating being caused by the release of methane and hydrogen gases by bacteria. This is what they do in response to sugar. So a lactulose-based breath test is being increasingly accepted as the gold standard for diagnosis of SIBO. Lactulose is a form of a carbohydrate. This is the testing that is used at major academic institutions such as Johns Hopkins and Cleveland Clinic and other leading institutions. A lactulose solution of sugar is given to the patient and the gases are measured in the breath as the liquid moves through the gut. These gases are measured in a lab and a raw result is sent to the physician who can then interpret the results based on patient history, symptoms, and the raw numbers. This test is not foolproof, so it's important to have someone experienced in its interpretation. There are foods that can increase gases, leading to false positive results. False negative results can be caused by recent use of antibiotics or anti-inflammatory drugs. It's important to get proper guidance prior to testing in order to get accurate interpretation. This is best obtained by a board-certified integrative medical doctor. Unfortunately, not many gastroenterologists are familiar with this testing, so it's critical to find out if the doctor you intend to see is familiar with diagnosis and treatment of this condition in order to reduce your risk of significant diseases down the road. Once diagnosed, the next hurdle is treatment. In 2013, Johns Hopkins studied and compared antibiotics to herbs for the treatment of SIBO. It was a fairly small study, but not many academic institutions are studying this condition yet, so it was important nonetheless. What they found is that herbs were actually better than antibiotics for the successful treatment of SIBO. What they found is that nothing was better than 50% effective. So antibiotics, in this case, a specific antibiotic called rifaximin, was shown to be only 37% effective for the treatment of SIBO. Successive treatment was determined by a normal breath test. So rifaximin only normalized the breath test 37% of the time. Herbal therapies normalized the breath test 47% of the time. So while it was significantly better, it wasn't better than 50%. So what Johns Hopkins did was they continued to use different herbal remedies. They had two different protocols that they would use, and they kept getting about 50% success. So what that meant is that as you continued to use different protocols, your likelihood of success increased incrementally. And if you're going to be using multiple protocols, it's important to use one that's safe long term. So herbals are considerably more safe than antibiotics. Rifaximin is fairly new. It's synthetic. It sits in the gut and is not absorbed into the body. While that appears to be an advantage, when we consider the microbiome in the large intestine and the damage antibiotics do to this delicate ecosystem, this is not an ideal solution. So the herbs that were specifically studied were a combination of one combination called FC-Cytal and Dysbiocide, and the other was called Candibactin AR and Candibactin BR. Again, no specific cocktail was better than 50%. Why? Because we're measuring gases, we're getting an indirect reading. And so we're not identifying the bugs specifically, so we don't know who they are really with certainty. And this makes treating difficult. So what else can we do? When we come back, we'll talk about how you can reduce your risk of SIBO and 5 tips to keep your gut healthy and happy. Right here on Dream Vision 7 Radio. Thanks for joining us. When we come back, we have a question from Robin that we'll address, and we'll give 5 tips on how to keep you and your family healthy and happy and free of SIBO. Thanks for listening. Please give us a call, 833-220-1200. We'll be right back.
What happens when we begin to realize that the 200-year experiment we've called the American healthcare system has failed? Learn how spirituality, ancient traditions, and cutting-edge science are merging to create a new paradigm of wellness on Awakened Wellness with Mylène Riobe, MD. Tune in every Tuesday at 11 a.m. and 11 p.m. Eastern Time with live shows on the first and third mornings when you can call in and ask Dr. Mylène the questions that matter most to you. Dr. Mylène is the medical director of the Riobe Institute of Integrative Medicine in Jupiter, Florida. For more information, visit riobeintegrativemedicine.com. Dream Vision 7 Radio Network invites you in for this dynamic, forward-thinking show.
Looking for a fun and relaxing getaway? Omega Rest and Rejuvenation Retreats are a great way to unwind and renew your spirit. Stroll through the garden, relax by the lake, or try a daily yoga or movement class. You can stretch your body, quiet your mind, and do as much or as little as you choose. Located in Rhinebeck, New York, just 90 miles north of New York City, Omega's natural environment and quiet pace allow for extraordinary experiences to unfold. Learn more at eomega.org.
After narrowly surviving the attack on Sandy Hook Elementary, first grade teacher Caitlin Royd DeBellis was left searching for answers that would never come. Eventually, she chose to focus on questions that could be answered. How do I make sure this tragedy doesn't define us? How do we get our control back? Those 2 questions led her to found the 501c3 nonprofit organization Classes for Classes. When gifts poured into their classroom, she decided they would help someone else by paying it forward and being kind. This developed into a social network which allows K-8 classrooms to connect so that every student in the United States can learn these crucial lessons.